Traditionally, the reimbursement process is followed sequentially with the regulatory approval process. After regulatory approval in the United States, if you need new physician CPT codes, then that will take a minimum of 15 months after approval, because that's how long the cycle takes. But in practice, then the CPT editorial panel, which is run by the American Medical Association, usually requires 2 to 3 years of experience. They require multiple publications in peer-reviewed journals and evidence that the procedure has obtained some level of adoption. And to some extent, it can be a catch-22, because obtaining the adoption is challenged by inadequate reimbursement. But as a rule of thumb, it usually takes between 2 to 4 years to get new physician reimbursement codes. And if new technology reimbursement in the hospital setting is to be obtained, there's a time window to obtain that within 3 years after FDA approval. The alternative approach is to obtain the existing reimbursement level, but then to provide information to the payer, such as CMS, once the technology has obtained adoption and it's reflected in the claims database of the payer, to justify a different payment category. And so that can take between 3 and 5 years. But there are many examples where this has been done successfully. New technology payments have been obtained by 19 different technologies over the last decade. There's a similar number of technologies that have gotten what are called transitional outpatient pass-through payments, which qualified for incremental reimbursement. And there's a large number of new technologies that have gotten separate physician payments associated with the new procedure. There are efforts between FDA, CMS, and the societies, as well as industry, to try to collapse that process and to make it more of a parallel process, so that it starts, the reimbursement process starts even before FDA approval. Recently, with transcatheter valves, both on the aortic and on the mitral side, there was significant interaction with both FDA and CMS before FDA approval, such that the national coverage process started immediately upon FDA approval and was completed less than a year after FDA approval. Similarly, new physician reimbursement codes were approved and went into effect less than a year and a half after FDA approval. So with upfront planning, it's possible to go through it much more quickly, but a lot of the legwork needs to be done in the 2-3 years before FDA approval.